Good afternoon. I'm Joe DaSilva, the CEO of the Texas Pharmacy Association, and here's my buddy.
Hi, I'm Justin Hudman, the Senior Director of Public Affairs here at TPA.
We wanted to cover a few bills that are still in the works with 2 weeks left of the legislative session. As you can imagine, things are either already decided or there's a lot of frantic legislators running around trying to get things done. So let me ask Justin to cover a few of the bills and update you on what the status is.
As Joe mentioned, this is the crunch time of session. Everybody's frantically trying to get their bills out of the other chamber. One of those bills that thankfully is not a frantic one for TPA is our epinephrine bill, our HB 1550. It was reported out of the committee last week, Health and Human Services, and is now waiting to be placed on the local and uncontested calendar, which is a good thing. According to our telecom, we have about a 97% chance of this becoming law, which is a good thing. This will give you the authority as pharmacists in an emergency situation to administer epinephrine. This is going to save lives, and it's something that at TPA we're very proud to have been the lead on this and champion something that really is about patient safety and about public safety. So the other bill I want to talk to you all about is our transaction fees bill. It was actually signed by the governor last week, which is a good thing. For those of you that don't know, transaction fees will clarify in statute that pharmacy benefit managers are not allowed to charge transaction fees, as they've secretly been doing in different forms or facets, changing the names. This makes it straight out illegal. And it was interesting because we had some opposition from the pharmacy benefit managers that all claimed that they weren't violating current law with these charges. But Governor Abbott surprised a lot of us when he signed it late last week. His predecessor, Governor Perry, generally didn't sign a lot of his bills until June.
Right.
So we're seeing a slew this past week or so of the Governor Abbott actually getting bills signed, which is interesting.
This particular issue was one that all of pharmacy was supportive of, and we acknowledge the great work that the Texas Pharmacy Business Council did in getting this bill moving. It's going to make a difference to the bottom line to many pharmacists across the state.
Absolutely. Another bill that we wanted to share with y'all today is the biosimilars bill. We've kind of kept y'all up to date over the weeks with that. Surprisingly, not a lot of movement yet. It got over out of both chambers fairly early on. We've now had the Senate appoint their conferees, but as of yet, we've not gotten any report back.
Both chambers passed it, as Justin noted, and but there was an amendment on the Senate side. And so it was sent to conference because the House sponsor did not concur with that amendment. And the conference committees are meeting now on many bills, this one in particular, and they still haven't issued a report as to which way it's going to go. Either way, it's a bill that pharmacy needs, because you need to be able to deal with biosimilars that are coming along and be able to provide them to your patients.
Yeah, this particular amendment, as Joe kind of directed to, helps pharmacy, but it doesn't hurt pharmacy if this amendment's not on. So either way, how this conference committee comes out, pharmacy is in a good position. We just need to make sure that the report comes out so that this bill will pass. It's just one of those that it was a little surprised when that amendment was tacked on in the Senate, but we hope we'll see something hopefully by the end of this week. Is what we're hopeful for, and early indicators are that the amendment is likely going to come out as per the House author's request and requirement on the bill.
Then you were going to visit a little bit about the
physician dispensing. Yeah, that one is, thankfully we didn't see it move in the final days when bills generally had to exchange chambers. Senate Bill 588 was left pending in the Health and Human Services Committee. Chair Schwartner did not let it out, which was greatly appreciated by pharmacy. And House Bill 1483 did not make its placement on the calendar. Last week on Thursday, all bills had to be out of the House by midnight. The gallery was full as staff, lobbyists, and interested public watched as the House had to get through the process of all the bills. And as the tradition holds, at midnight the clock struck 12. A point of order was called for against any further consideration of legislation, and the night ended with everything not yet read on the calendar for a vote dying, and anything that hadn't been placed on the calendar House bill wise no longer being eligible to be voted on or discussed in the House.
And though both bills have failed in their respective chambers, it doesn't mean that the war is over, because there still is adequate time for the proponents of the physician dispensing to attempt to include it as an amendment onto other bills. Fortunately, there are not that many other bills that it would qualify to be placed as an amendment, but we still keeping a watchful eye. Then, just in closing, obviously there are literally hundreds of bills that were filed that impacted pharmacy. Those that did pass, you will be receiving from us the next 2-3 weeks a summary of what happened, what they do, what you may need to do to prepare for the new law. Most of these are coming into effect September 1st. And I know that both of us would very much like to thank so many of you that are listening in, most especially the students, for all the work that you've done. Believe me, believe us, it made a difference in what passed and what didn't pass. And the latest perfect example is in the naloxone legislation, in which Renee Garza here from Austin testified, and that particular bill, we were the only ones testifying this late into the session in support of the issuance of prescriptions to patients, families, and friends. When is needed, they'll have the drug to be able to take care of any accidental overdoses. So with that, let me turn it over to Justin to close out.
Well, we thank y'all, as Joe said, as somebody that's got my boots on the ground, as it were, there for y'all in the Capitol. People talk. People mention about the fact that we had so many pharmacists show up when physician dispensing was discussed, how many people showed up for the medication synchronization. It makes a difference when you show up and when you participate in the legislative process. And I, as your lobbyist, depend on you to help me be your voice. And when you step up and you call, you do the emails, you make the appearances, you help me do my job to help you. So we thank you. We hope y'all like this process. We're going to continue to try to tweak it and work on it, but we hope you enjoy our videos.
And to have a very memorable Memorial Day in honor of the many veterans and others that have served our country. Take care.
Thank you.